Generalized anxiety disorder, GAD. People with generalized anxiety disorder, GAD, experience excessive worry and anxiety about various aspects of their lives, like work, health, or relationships, even when there's no specific reason for concern. This constant worry can make it hard for them to relax or concentrate on tasks. For example, someone with GAD might find themselves constantly worrying about their loved one's safety, even when they're just going about their daily routines. These worries can interfere with their ability to function normally and may cause physical symptoms like muscle tension or headaches. Treatment for GAD often involves therapy, medication, or a combination of both to help manage symptoms and improve quality of life. Panic disorder. Panic disorder is characterized by sudden and intense feelings of fear or dread, known as panic attacks, which can happen unexpectedly and feel overwhelming. These attacks often come with physical symptoms like a racing heartbeat, sweating, trembling, and difficulty breathing. For instance, someone with panic disorder might be shopping at a grocery store when suddenly they feel like they can't breathe and fear they're having a heart attack. Panic attacks can be so distressing that people may develop a fear of having another attack, leading to avoidance of places or situations where attacks have occurred in the past. Treatment for panic disorder may include therapy, medication, or both, aimed at reducing the frequency and severity of panic attacks. Social anxiety disorder, social phobia. Social anxiety disorder, also known as social phobia, is characterized by an intense fear of social situations and a persistent worry about being judged or embarrassed by others. People with social anxiety often avoid social interactions or endure them with extreme discomfort. For example, someone with social anxiety might skip social events, avoid speaking in public, or struggle to make eye contact during conversations. This fear of negative evaluation can significantly impact their ability to form relationships, pursue opportunities, or enjoy social activities. Treatment for social anxiety disorder typically involves therapy, such as cognitive behavioral therapy, CBT, to challenge negative thought patterns and develop coping strategies for social situations. Specific phobia. Specific phobia involves an intense and irrational fear of specific objects or situations, such as heights, spiders, flying, or enclosed spaces. Even though individuals with specific phobias may recognize that their fear is excessive or unreasonable, they often experience intense anxiety when confronted with their phobia. For instance, someone with a fear of flying might avoid air travel altogether or endure it with extreme distress. This avoidance behavior can interfere with daily life and may lead to missed opportunities or significant impairment. Treatment for specific phobias often involves exposure therapy, where individuals gradually confront their fears in a controlled and supportive environment to reduce anxiety responses over time. Agoraphobia. Agoraphobia is characterized by a fear of being in places or situations where escape might be difficult or help might not be available in case of a panic attack or other emergencies. Individuals with agoraphobia often avoid crowded places, public transportation, or situations where they feel trapped or unable to leave. For example, someone with agoraphobia might avoid going to the mall or using public transportation because they fear having a panic attack and being unable to escape. This fear can significantly impact their ability to engage in daily activities or attend social events. Treatment for agoraphobia typically involves therapy, such as exposure therapy or cognitive behavioral therapy, CBT, to help individuals confront and manage their fears. Separation anxiety disorder. Separation anxiety disorder is commonly seen in children, but can also occur in adults, and involves excessive fear or worry about being separated from attachment figures, such as parents or caregivers. Children with separation anxiety may cry, cling, or throw tantrums when separated from their loved ones, while adults may experience intense anxiety or distress when apart from their partners or close family members. For example, a child might refuse to go to school or stay overnight at a friend's house because they fear being away from their parents. This fear of separation can interfere with normal activities and may lead to significant distress for both the individual and their loved ones. Treatment for separation anxiety disorder often involves therapy, such as cognitive behavioral therapy, CBT, to help individuals develop coping strategies and reduce anxiety symptoms. Obsessive compulsive disorder, OCD. Obsessive compulsive disorder, OCD, involves unwanted intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed in response to these thoughts. Individuals with OCD may feel driven to perform rituals or routines to alleviate anxiety or prevent a feared outcome, even though they recognize that their behaviors are excessive or irrational. For instance, someone with OCD might feel compelled to check the stove multiple times to ensure it's turned off, despite knowing they turned it off already. These obsessions and compulsions can consume a significant amount of time and interfere with daily life, work, and relationships. Treatment for OCD often involves therapy, such as exposure and response prevention, ERP, and medications to help manage symptoms and improve quality of life. Acute stress disorder. Acute stress disorder is similar to PTSD, but occurs within a month of experiencing a traumatic event and lasts for a shorter period. Individuals with acute stress disorder may experience symptoms such as flashbacks, nightmares, hypervigilance, and avoidance of reminders of the trauma. For example, someone who witnessed a car accident might have intrusive memories and nightmares about the event, along with feelings of anxiety and distress. These symptoms typically resolve within a few weeks to a month, but can cause significant impairment in daily functioning during that time. Treatment for acute stress disorder may include therapy, such as trauma-focused cognitive behavioral therapy, CBT, and medications to help manage symptoms and promote recovery.
Illness anxiety disorder, hypochondriasis. Illness anxiety disorder, formerly known as hypochondriasis, involves excessive worry about having a serious illness, despite medical reassurance and little evidence to support the presence of such an illness. Individuals with illness anxiety disorder may constantly monitor their bodies for signs of illness, seek repeated medical evaluations, and engage in excessive health-related behaviors, such as researching symptoms online. For example, someone who fears they have cancer might repeatedly visit doctors, request numerous tests, and constantly check their body for signs of disease, even when there is no medical basis for their concerns. This preoccupation with health can significantly interfere with daily life and cause distress for the individual and their loved ones. Treatment for illness anxiety disorder often involves therapy, such as cognitive behavioral therapy, CBT, to help individuals challenge their health-related fears and develop coping strategies for managing anxiety. Adjustment disorder with anxiety. Adjustment disorder with anxiety develops in response to a significant life stressor or change, such as job loss, divorce, or illness, causing marked distress or impairment in functioning. Individuals with adjustment disorder may experience symptoms such as worry, nervousness, irritability, or difficulty concentrating, which exceed what would be expected in response to the stressor. For example, someone who loses their job might feel constantly worried about their financial situation, have difficulty sleeping, and struggle to focus on finding new employment. These symptoms typically arise within 3 months of the stressor and resolve within 6 months once the stressor has been addressed or adapted to. Treatment for adjustment disorder with anxiety often involves therapy, such as supportive counseling or cognitive behavioral therapy, CBT, to help individuals cope with the stressor and manage anxiety symptoms. Substance, CHOC, or medication-induced anxiety disorder. Substance-induced anxiety disorder involves anxiety symptoms that develop as a result of substance abuse, medication use, or withdrawal from substances. Certain substances, such as caffeine, stimulants, alcohol, or drugs, can trigger or exacerbate symptoms of anxiety in susceptible individuals. For example, someone who consumes excessive amounts of caffeine may experience symptoms such as jitteriness, racing thoughts, or panic attacks. Similarly, withdrawal from substances like alcohol or benzodiazepines can cause rebound anxiety as the body adjusts to the absence of the substance. Treatment for substance-induced anxiety disorder often involves addressing the underlying substance use disorder through therapy, support groups, and sometimes medication to manage withdrawal symptoms and stabilize mood. Anxiety disorder due to another medical condition. Anxiety disorder due to another medical condition involves anxiety symptoms that are directly caused by a medical condition, such as heart disease, respiratory disorders, or hormonal imbalances. Certain medical conditions can produce symptoms of anxiety through physiological mechanisms or alterations in brain chemistry. For example, someone with an overactive thyroid gland, hyperthyroidism, may experience symptoms such as rapid heartbeat, sweating, and nervousness due to the excess production of thyroid hormones. Similarly, individuals with heart disease or respiratory disorders may experience anxiety symptoms related to their underlying health condition. Treatment for anxiety disorder due to another medical condition involves managing the underlying medical condition through appropriate medical interventions, which may include medication, lifestyle changes, or surgical procedures, along with addressing anxiety symptoms through therapy or medication as needed.